Good day, everyone. My name is Dr. Cecil Boston, and I'll be making a presentation on the knowledge and utilization of traditional medicine for type 2 diabetes in Pakuri, St. Cuthbert Mission in Guyana. Now, the study utilized a cross-sectional design using a systematic random sampling in order to get the sample population. Now, prior informed consent was obtained from each participant in order to be included in the study, and the studies got approval from one institution and the village. That would be the Ministry of Health, the Ministry of Indigenous People Affairs, and the Village Council. Now, the study included 318 participants. And what was found within the study, that 51% of those participants were considered as having good knowledge on traditional medicine and its utilization, while of the study population, 41% were diagnosed with diabetes. And it was found that those that were diagnosed with diabetes were using a combination. Some were using just traditional medicine, others were using conventional medicine, and there were also a population within the study that utilized both traditional and conventional medicine. Additionally, what was found is that there were strong positive correlations between age, sex, level of education, and age, sex, level of education showed strong positive correlation to use of traditional medicine. But what was interesting to note is that the use of traditional medicine, or the knowledge on traditional medicine, is not being passed down from one generation to the next, and it is assumed that the information is being lost through the process of acculturation. Additionally, the climate change has now begun to threaten within Guyana our inland areas. And what is being observed is that floods are now beginning to threaten the inland areas. The biodiversity is being lost if systems are not put in place to protect the biodiversity of those communities, and therefore protect our traditional medicine, right? So it is important for us, especially within these, especially in looking at the widespread use now of traditional medicine, even in the context of COVID, where a lot of countries are advocating the use of traditional medicine. And so it becomes important that we protect the biodiversity from biodiversity loss through the effects of climate change. So therefore, it becomes absolutely necessary in linking biodiversity loss to health outcomes, and we see that link that exists there in terms of biodiversity loss and health incomes, because a lot of persons, especially those indigenous communities, depend on the land for medicinal purposes, and if that is lost, then it threatens one of their way of existence. So thank you for listening, and I'm hoping that you have questions for me that I'm sure that we can all learn from today. Thank you.